Hi, my name is Christina, and this is my administering a tuberculin injection. First, I would verify the physician's order. Then I would verify the 6 rights of medication administration: right dose, right route, right patient, right medication, right time, right documentation. I would check the medication order in the EHR. Then I would do any drug calculation needed. Today the doctor ordered 0.1 milliliters of tuberculin skin test intradermally. This drug is supplied in 5 tuberculin units per 0.1 mLs. I would gather the correct supplies, enter the room, close the door for patient privacy, perform hand hygiene, introduce myself to the patient. Hi, Mr. Smith. My name is Christina. I am your nurse today. Can you please verify your name and date of birth for me? And I would check his wristband while he was verbally verifying his name and date of birth as a double verification. Perfect. Mr. Smith, do you have any allergies to food, medication, or any environmental allergies? No. Okay, perfect. So today I'm here to administer your tuberculin skin test. This is to a test for infection of the microbacterium tuberculosis. Some common side effects would be pain at the injection site, localized rash or bruising. Some adverse effects could be shortness of breath and swelling of the airway or face. If you do experience any of these adverse effects, please let me know immediately. Also, you may feel a slight stinging or burning sensation while I am administering the injection. That's very common. Do you have any questions for me? Perfect. So I would perform hand hygiene, apply my clean gloves. I would then select the correct gauge and length of the needle for this injection, and also the correct size of the syringe. Today we will be using a tuberculin syringe. It has an attached 2.5 gauge 5/8 inch needle. It's a 1.0 mLs. I would verify we had the correct tuberculin vial. We'd open up an alcohol wipe and wipe the top of the vial for withdrawing any medication. I would safely remove the cap and pull down 0.1 mLs of air. I would then insert that air into the medication vial. Then I would withdraw 0.1 mLs of medication. Safely recap that. Tap to get rid of any air bubbles. Okay. And that is 0.1. You can see that. Okay. I have my vial recapped. If I prepared this elsewhere, I would make sure I labeled the medication with the correct medication and dose on here before I took it to the patient. So for the intradermal, we want to use the forearm, 3 to 4 fingers width below the antecubital space, and 1 hand width above the wrist on either arm. If that is not an acceptable area, we could use the upper back if needed. We would check for lesions, discoloring, or any tenderness before administering the injection. I would then get an alcohol wipe and cleanse the site in a circular motion, inside to out, about 5 centimeters. Okay. I would allow that to dry, air dry, not blowing on it or waving to dry it. I would then remove the top of the needle, stretch the skin, point the bevel of the needle up. I would then inject 5 to 15 degree angle through the dermis, about 3 millimeters of the skin's surface. Know if we can still see a bulge from the needle tip below the skin, since we're not very deep. So then I would go ahead and administer that medication slowly. Perfect. Normally if you feel resistance, that means that you are too deep and you would have to remove and start all over. Once we administered that medication, we would notice a bleb about 6 to 10 millimeters, kind of resembling a mosquito bite. We would then withdraw that needle, put the safety cap on, cover it with an alcohol swab, not massaging, just hold it there. If they need a bandage, we would go get one. We would not recap the needle. We would just discard both the cap and the needle into a sharps container at that point. Everything looks good. Are you okay, Mr. Smith? Perfect. All right, I would then remove my gloves. I would then perform hand hygiene, and then I would go document what I just did.